But is this something that you're going to actually use, or
I'll probably use parts of it. I'll probably use like 10 seconds of it or something like
use
that.
the content to? Yeah. Well, okay.
We'll see. So hey everyone, it's John from Monthly Experiments Project. I'm here meeting with Dr. Brown. I'm in Dr. Brown's office, and we're getting ready to do a neurofeedback session. And I kind of wanted to show you what how the setup is, because it's hard to talk about this stuff. So I'm going to show you a little bit. I'm doing beta training today, so I'm training my beta brainwaves. And to do that, we use a computer program where I'll be watching a DVD and trying to make the picture bigger. I'll show you what I mean in a minute. But I just chose the DVD. I'm going to be watching Lord of the Rings today, and Dr. Brown is about to put a sensor on my head, so we're just getting ready to do that. But yeah, so first we're going to clean my earlobes so there's no oils or debris or dirt on the skin, so we get a clean connection. There's one sensor that goes on the top of your head, and then two sort of
reference electrodes
that kind of calibrate the signal that are placed on your ears.
Yeah, that sounds fine. So this is called a preparation, skin prep.
Okay, we're doing skin prep.
And the whole thing is called a placement.
And putting it on the head is called a placement. That's it in like neurofeedback terminology.
Exactly, yeah.
Cool. I'm in a very comfortable chair. This is like it's like if you're flying a spaceship, this would be your comfortable chair. That's what I used to think of it as.
The reason for the comfortable chair is so that people can completely relax their muscles and not have their muscles interfere with this signal.
Oh yeah.
Because muscle can induce artifact signal, erroneous information that isn't valid. So that's the real reason for the chair, and also to have a comfortable chair.
Sure, if you're going to be sitting.
Yeah, but it's so that people can so that people can manage their musculature, relax it, and not include it in the signal.
Basically, neurofeedback is about measuring electrical activity.
Yeah.
And if you have a lot of muscle movement, that creates electrical activity. But we want to
that's exactly right.
We want to measure the really subtle electrical activity coming from the brain itself. We don't want to measure my arm moving or my shoulders being tense.
And those things can interfere with the signal, so it will create erroneous information.
Right.
And render what we're doing invalid. So it's very important that the individual is totally relaxed. And sometimes with some people, I prepare them and do a relaxation neuromuscular calming sequence, a verbal type of exercise, where we go through all the muscles from their forehead, their eyes, their face, their neck, their shoulders, their chest, their abdomen, then their upper, mid, and lower back, and then the pelvic region, and their upper, lower, and the legs, and ankles, and feet, and toes, and get them really, really relaxed before doing this.
You've done that with me a few times, and it really works. I remember when I was doing the alpha training, I would get really relaxed.
Yeah, and then I also, create a CD of this for people to use on a CD player or on a laptop, or download into an MP3 and use it that way. And they can have it any time or place they want. And it's kind of like homework as well. Depending on what they're doing, they can use the CD to maintain a level of relaxation physically before they go to bed or something, so that they will sleep better. Okay. Right, so the placement is complete.
Is it on there? I'm sure the camera will pick that up. It's facing front facing.
Yeah.
Cool.
Okay.
Thanks. All right. So in the next part of the video, you're going to see. By the way, these things it's it's comfortable on the head. You can relax. It doesn't. There's not a pinching sensation or anything like that. And the sensor is just set on top of my head with a little bit of adhesive that washes right out.
Yeah, well, it's a conductive gel.
Conductive gel.
Conductive electrode paste.
Same as if you have like an electrocardiogram or something like that. Oh yeah, we can take a picture of it. It's this stuff. So get some 1020 conductive gel.
Yeah.
On top of my head. Thanks.
Yeah, it's called Neurodiagnostic Electrode Paste.
Nice. All right, so in the next video you'll see what I'm seeing on the screen. This is the screen that I'm going to be controlling with my brain in a minute, and yeah, we'll see how this goes.